see on the agenda a presentation by our police chief explaining to us reforms that have been made in the police department. Chief Mitchell. I think so.
So as you are aware, there's been protests that have been ongoing for several weeks throughout the nation. As part of that protest movement, there's been a cry for police reform. They work better when they're turned on, apparently. So I wanted to get on the agenda and just have a conversation about police reform, give some facts about what police reform is in the eyes of the reformers and what we as a department and what many other departments have done well before the protest erupted weeks ago. If you have not yet heard of this campaign, you will, but there is a nationwide campaign called the 8 Can't Wait. It talks about 8 policies. The research has shown that this effort started in about 2016. It's a gentleman from Stanford, a student from Stanford or a graduate of Stanford. I don't believe he's affiliated with the university as a professor. He has done a lot of research across the country. One of the things that he did is he looked at the 100 largest police departments in the country, and he came up with these 8 policies that in his estimation, if you follow these 8 policies, you will reduce police in custody deaths in the country by 72%. I had never heard of this campaign until about 6 weeks ago. I have no clue if this has been validated by independent researchers. So I at least wanted to talk about it. He claims that he did this research by consulting with legal experts, academics, and police reformers. If you go to their website, just to give you a little bit of their motivation, if you will, in releasing the 8 Can't Wait, right on their website, they claim that their ultimate goal is an absolute liberation from policing, so that, of course, if they were true to their word, that would mean that there would be no police in the country. And they also demand defunding of the police and an abolition of the police. So that is where they come from as an organization. Here are the 8 policies that they say police departments should focus on. I'm not going to spend a lot of time on this slide because I have a standalone slide for each one of these 8 principles. But those are the 8 principles on one slide. In their research, they claim that if police departments, if you had to pick among the 8 policies, if you just picked 3 of the 8, you would have these reductions in police death. So if you just had a comprehensive use of force policy, that would be a 25% reduction. If you would have a policy that you must exhaust all alternatives before using deadly force, that would be another 25% reduction. And if you would ban chokeholds, that would be a 22% reduction. If you do all 8, you get to a 72% reduction, which I don't know how that math works, because if you do these 3, you're at 72%. But they claim if you do all 8, you'll get to a 72% reduction. Now I'm going to talk about our department and our trainings and our policies in each one of these 8 areas. So the first one is de-escalation. That is something, if you're not familiar, we're going to talk about a little bit later in the presentation. The state of Wisconsin, in some articles, has been referred to as the gold standard in terms of training that police officers get for how to use force. We have had comprehensive policies since the 1980s. It initially was called RISC, R-I-S-C, and it later, in the 90s, was changed to DAT. DAT stands for Defensive and Arrest Tactics. This has been taught in the academy to every police officer in the state of Wisconsin, and then police departments in the state follow the model practices of DAT in the policies that we have. So some of the things that we have in our policy about de-escalation, you can see the first bullet point talks about mental illness. We tell officers right in our policy that people in a mental health crisis might feel threatened by the police. The police can defuse a potentially dangerous situation by simply being patient. That is word for word right from our current policy. In another part of our policy, we have the next bullet point. You can reassure the person that you don't intend to harm them. And the bullet point directly below that talks about the level of force that you can use, but it again is another example of de-escalation. The very last line in that bullet point is once you have gained control of a subject, you must reduce the level of force to that is needed to maintain control. So use the appropriate amount of force. Once they're under control, use a lesser amount of force just that you need to keep them in control. Another example of de-escalation in our department is, of course, the CART program that this council approved of in 2018, initially on a 2-year grant. And then in this year's budget cycle, you funded the position in its entirety. So the CART officer, which is the Crisis Assessment Response Team, responds to incidents of mental health episodes for citizens of our community. The officer is partnered with a clinician from Milwaukee County Mental Health, and the two together go to homes and work on people that are in acute mental health crisis. They help manage many people that live in our community and are under a plan for mental health, even if they're not currently in an acute state. That's a classic example of a de-escalation program. I will point out another de-escalation program that our department has done is the crisis intervention training. Every police officer in our department is CIT trained, and that training is specifically designed in how to deal with people with mental health issues. The second tenet in the 8 can't wait is that a department should have a use of force continuum. So a continuum is essentially how do you use force and what are the levels within force, with certainly deadly force being the highest that you can get on the continuum and presence being the lowest. Just the fact that a police officer shows up and engages with you, that's presence. So we have had a continuum in our department for decades. It's not a policy that's going to go away. And this again goes back to the DAT guidelines that the state puts out and that police departments follow within the state. It's been around for decades. The third tenet, and I should have said, any question that you have at any point, I'll gladly do it during the middle, I'll do it at the end, whatever is your choice. So the third tenet of 8 can't wait is to ban chokeholds. The state of Wisconsin Defensive and Arrest Tactics Training does not train chokeholds. So the fact that it is not trained means that it is not a technique that can be used by a police officer in the state of Wisconsin. This calls for an outright ban on chokeholds. We're already there, and we'll talk a little bit more about chokeholds when we get into the president's executive order on safe policing. The next tenet is for the police to require a warning before they shoot at a suspect. I can tell you for decades that is exactly how law enforcement in this state has trained. However, certainly under the use of force continuum, an officer, there are going to be times that an officer may not be able to give a warning to you. but this is directly from our policy. The most important 2 words in this policy are if possible. 8 can't wait would have you believe that the world is filled with bright line rules, that the world is black or white, and that there are yeses and nos. If you look at our policy, the 2 most important words are if possible. The officer should, if possible, do the following 3 things. Identify yourself as a police officer. Order the suspect to stop the action that they're doing, and then threaten to use deadly force before actually doing it. Now, a scenario I'd like you to consider, and departments in this area have done this throughout the last several years. If we encounter you and you're a threat and you're armed with a firearm, and there's no one else in the area and the gun is simply at your side, the officer at that point has more than enough justification under the law to shoot you. That is not what your average police officer does. The average police officer, because it's been conditioned in them through training, begins to dialogue with you. Tonight's probably not the night, but I can definitively prove to every person in this room, if you are armed with a firearm and it is at your side and you have target acquisition, your eyes are looking at me, the minute that I start to talk to you, if you decide to shoot at me, even if my firearm is raised and pointed directly at you, you will fire before I can fire. It's just the ability of the human brain to process and then react. So police officers every day put themselves in jeopardy to dialogue with people that are armed with firearms. That is the norm. The police officer putting themselves at a disadvantage to try and talk down a situation in which a person has a firearm. Now, I'll give you another scenario to consider to prove that the world is not filled with bright lines. If a police officer walks into this room right now and they witness someone in this room shooting another person in this room, do we as a society want that police officer to say, I'm here, I'm the police, stop doing what you're doing, or I'm going to shoot you? I suspect in that scenario, we would rely heavily on the if possible portion of our policy, and the police officer would use deadly force against the person who's using deadly force against another citizen. So it is ingrained in us in training, always, always, always give warnings if possible. But it is not always possible. It is invariably, it's 95% of the time it's possible, because the person is not immediately doing something to threaten another. But I just wanted to have a good conversation with that, so that if you get one thing out of, well, if you get 2 things out of tonight's presentation, A, most police departments, and especially our police department, are already doing 98% of the 8 Can't Wait campaign. And the second thing I'd like you to understand, there are very few bright line rules in policing, and that's an example of it. The next tenet is under 8 Can't Wait is no shooting at moving vehicles. They want an outright ban at the practice of shooting at moving vehicles. Most police departments, including our police department, have a policy that says, we don't want you to shoot at a moving vehicle. We would like you as an officer to get out of the way of the moving vehicle. We'd like you to find options other than shooting at a moving vehicle. However, again, the world is not filled with bright lines. If you read newspaper accounts from across the world, you'll understand that there are individuals that now use their vehicles as weapons. So if this city has an incident with a person experiencing a mental health crisis, or it's an outright incident of terrorism where a vehicle is being used as the weapon. It's happened in France, it's happened in New York. I don't believe that it will ever happen in our city, but we do need to talk about it. If you have an outright ban on shooting at moving vehicles, does society want the police officer to get to a parking lot of a school and see someone mowing down children with a vehicle, and for the officer to go, he's in a car, I can't shoot at him. So again, very few bright lines in the world, and that's another example. So some of the catchphrases in this bullet point: last resort and greater danger exception. In our policy, we tell the officers, don't shoot at the moving car unless there is a greater danger by not shooting at the moving car. So if I shoot at the moving car, let's say theoretically I would endanger a single citizen who is beyond that moving car, that's a danger. The greater danger is not shooting at the car and the car mows down 20 people at the farmer's market or in a shopping district or wherever it might be. That is ingrained in officers through training. So again, not really a bright line rule, but that is what this campaign is calling for. The next tenet is to exhaust all alternatives before shooting at a suspect. And this, again, is something that we have trained for a very long time. This is not something that police departments don't train for. And these are some exact language from our policies to show that we train this. The very first bullet point: you must eliminate all other reasonable alternatives. That's telling the officers to exhaust all possibilities before discharging your firearm. So this is something that is in our policy. It is something that we have trained, and almost every police department trains for the last couple of decades. Another very common tenet in the 8 Can't Wait is the duty to intervene. Essentially, if a police officer sees another police officer doing something that is illegal or against policy, they have an obligation to ask that officer or make that officer stop. It's been in our policy for years. I underline the pertinent point. We essentially tell the officers, you have a duty to intervene and report if you witness excessive force. And I speculate that most police departments have a very similar policy to that. Comprehensive reporting is another tenet of the 8 Can't Wait. I was reading a report from another state, from Massachusetts, where the feds were looking at a local police department and for how they documented use of force. That department still didn't document all uses of force. They would only document if they used the firearm and I believe the baton, but they could use OC or the spray and not document it. Our department, for years and years and years, has had a comprehensive use of force policy. When officers use force, they're required to do reports on that use of force. Supervisors review that use of force to ensure that it is within law and within policy, and it ultimately is reviewed by a captain of police. So we have a very robust reporting system. We have a very robust auditing system, if you will, of the use of force. Some of the things that we're mandated to report when we use OC spray, if we use a taser, active countermeasures, that would be directing someone to the ground. Diffuse strikes would be striking someone as it sounds. Intermediate weapon is your baton. If you would pull your baton out and strike someone in a target area with that. If we use the canine, or any level of force that leads to an injury of the officer or the subject. So if an officer simply pushes you and you lose your footing and you stumble to the ground and you hurt your hand, we're going to treat that as a use of force. We're going to document it. It will be reviewed by a supervisor. The final bullet point in this slide, about 2016, actually before that, 2014, the state of Wisconsin passed a state law that any incident involving an in-custody death involving a law enforcement officer had to be investigated by an outside entity. Since that time, every incident that we have had involving death has been investigated by an outside entity, and our department participates in a countywide team. Actually, now it includes Waukesha County, known as the Milwaukee Area Investigative Team. We're one of 6 lead agencies on that team, so we take turns rotating throughout the calendar year. And it would not be unusual now if you see a City of Waukesha officer involved in a deadly encounter. It could be the West Dallas Police Department that is the lead agency investigating that. So we have participated in that program for years. So we as a department have always had comprehensive reporting, and we will continue to do so. So that is the final of the 8 can't wait. I thought I would also talk a little bit about training that the average department member gets. In our mind, training as a goal is for us to reduce the number of use of force incidents that we have and to have a better outcome when we do actually have to use force. As you can see, there's some bullet points what we believe we get when we properly train an officer. Every officer in the state of Wisconsin goes to a recruit academy for 720 hours. We are in a handful of police departments in the state that when they complete that 720 hours, we give them another 6 weeks of instruction, or 240 hours of instruction, inside the West Dallas Police Department. And some of the things that we talk about during that 6 week are, again, we get heavy into our use of force policies. So even though they're trained in the academy on how to use force, we give them more training in that area when they get to us because we deem it to be a high-risk activity that they have to engage in from time to time. We talk in that 6 weeks of training about the duty to intervene, the obligation that they have to stop their partners if they're having a bad day and they do a wrong thing. We talk about their responsibility under the Code of Ethics to report that conduct to us. We talk about DAT, we talk about deadly force, and we finally talk about how they can communicate in a professional manner. All of those topics are covered in the 720 hours. We feel they're important to cover them again as a department before we put the officer on the street. In addition, every police officer in the state is required to get 24 hours of training on an annual basis, or they lose their certification. In West Dallas, we give 32 hours of training, so we go above and beyond the state requirement, and for most officers, we go above and beyond the 32 hours because most officers find elective classes that they would like to attend, and if we have the funding for it and staffing allows, we allow them to attend additional trainings. So we're a very well-trained police department. Some of our practices that we have as a department to attempt to get the best officer that we can and to have the best outcome that we can when we have a use of force situation. Every single member of our department that is hired takes a psychological test before they are hired. We're looking for their suitability with our department and do they have the mental health capacity to perform the high-risk functions that we expect them to do. Not unusual to have someone fail that test. If they fail that test, we will not hire them in the city of West Dallas. One bullet point I probably should have put on here that I did not, but I'll talk about it briefly now. When I got hired in 2016, so recruiting for a profession, we have had a rough past 5 to 7 years. As the economy has gotten better, people are seeking different jobs than law enforcement. As bad as this might sound, in a bad economy, everyone in government, we get more applicants than when there is a very good economy. We ran a process about 3 years ago. The number of applicants that we get as a profession greatly down. In the old days, if we would have got 200 applicants, we now get 25. We did a process about 3 years ago, about 25 applicants, did not hire a single person off of that list. Just scrapped the entire list and started over from scratch. One of the things that I have talked to the Police and Fire Commission about, I am not interested in hiring minimally qualified people. I am interested in hiring exceptional people that I know can get the job done and will have a good career with our department. If you as an employer start to reduce your hiring standards, I can assure you that you eventually will have problems with your employees. So as a department, we are willing to carry vacancies as opposed to hiring people that we don't think we should hire. The second bullet point, the CART team is a practice of ours designed to help give us a good outcome. We've already talked about that. We've already talked about MATE. The final, or the last two bullet points I'll talk a little bit about. A thing that you've probably read about in the last couple of years, and it's in the President's executive order that we'll talk about in a little bit, is people are starting to figure out that the mental health of officers is important. And that if you have an officer that's got poor mental health status, they're more likely to use inappropriate force. They are more likely to do inappropriate things at work. So it is a goal of us as a profession to hire people of sound mental health. And then during the course of their career, as they see things that ordinary people never see, but police officers see it routinely throughout the course of their career, there's been a strong emphasis in the past 5 years to keep the mental health of the police officers at a good level. So a few years ago in our department, we stood up a police officer support team. As a department, we said it was something that we would like to see occur, but we knew it would not happen if it was a management-led initiative. We needed the officers to want to do it. They jumped on board. They wanted to do it. We provided money. We sent officers to training. We now have a very robust police officer support team. They're a group of volunteer officers that if their partners are having a problem, they can speak to a post officer. They have some level of confidentiality, not as much as a licensed therapist. But the most important thing that the post team has is a Rolodex. If you're experiencing problem, post has doctors that they can refer you to that deal with law enforcement, understand what we go through on a daily basis. So we have taken great steps to help keep the mental health as high as we can in our employees. EAP, that's something that the city has participated in. That's something that we ask officers, if they need it, please use it. It's there, it's free. The final thing, and we'll talk about this a little bit in the President's order, we have been an accredited agency for a very long period of time. And that, again, we'll talk about a little bit more under the President's order. So now we're into the President's order, and he's got a few different things that he signed in a document back in June. So the way that presidential orders work, at least as it pertains to policing, they have very limited authority as the federal government to tell a local police department what to do. But they do what the feds have done for a long time. They attach it to money. So under the President's order, if you wish to participate in federal grants, and our city is a heavy participant in federal grants, you will do the following things to be eligible for those grants. Again, I'll demonstrate to you everything that he wants us to do, or is proposing we do, we have been doing for a very, very long period of time. So the first bullet point is that if you want to receive federal grants or federal funding, you must be an accredited agency by a firm or an organization that the Attorney General approves of. Or you must be in the process of getting accredited. I think when they put that in the process, they understand that it can take, from the time that you say you want to be accredited, it can easily take 2 to 3 years to get to the point that your policies are in a good enough position that you would pass an audit or an inspection. So again, we have been continuously accredited since 2010. So we already meet the first practice that the President would like to see law enforcement do. The accrediting agencies should have policies in these specific areas: use of force, de-escalation, performance management tools, which would be like an early warning intervention program, and community engagement. Wiley-Ig, who is our accrediting agency, has policies or requirements in all of those areas, And the fact that we keep passing their accreditation standards means that we have policies in those areas and that we follow those policies. We shall have, a local agency shall have use of force policies that follow federal and state law. Well, I don't think it would be a good policy if it didn't meet the low hurdle of following the law. So all of our policies follow the law. Policies must prohibit the use of a chokehold. So this is going to be the first nuance of the night. If you'll recall, under the 8 can't wait, I told you that we don't do chokeholds because we're not trained in how to do chokeholds, and therefore we can't do them. The President's executive order explicitly states that your policy will prohibit chokeholds unless deadly force is authorized. So we're in the process of updating our policies to comply with the President's executive order so that we can continue to receive funding. So in the 8 can't wait, they have a bright line belief. The police can never perform a chokehold on someone. Under the President's policy, we can do a chokehold, but only if we can use deadly force. So to put it in layman's terms, under 8 can't wait, if we banned chokeholds and an officer could theoretically use a chokehold to get out of a deadly situation, they would be forbidden under 8 can't wait from doing that. So if you eliminate what an officer can do, what would he or she revert to next? They can't choke you under 8 can't wait. What would they do? They would pull their firearm and they would shoot you because that would be allowed. So the President's policy says if you can use deadly force, then you can do a chokehold. So we're in the process of updating our policies to specifically forbid them, if that makes sense. The Attorney General has been directed by the President to identify opportunities for police officers to form partnerships with mental health professionals. That is exactly what our CART program is. So the President is now encouraging departments in the nation to do what the West Dallas Police Department has been doing for 3 years. And we are in a minority of departments that do that. The Milwaukee Police Department does that. In the state of Wisconsin, I would be surprised if there's more than 5 police departments that do that. So I could see that eventually being a resource issue. You would have an easier time getting a police officer to be on that team than you would in mental health, providing a practitioner. So maybe you'd have to like regionalize it or make it a countywide team, or perhaps the city of West Dallas, and well, we're a bad example because we already have it. Perhaps the city of Wauwatosa would have to hire their own mental health professionals that could then ride with a police officer in a car. But we've had great success with the CART program. So we're already doing what the President believes would likely lead to a reduction in fatal encounters with the police. This we've already talked about briefly, but the President is telling Congress, I'd like you to find a way to provide funding for mental health treatment for police officers. That is something in our area that we've had a lot of good advancement. So we've already talked about, we have a peer support team, we have EAP, but a new addition to this is a CIVMIC program that started in 2019. Our city was one of the cities that was pushing CIVMIC to open this up as a possibility. Under the CIVMIC program, if you are a first responder and you have a mental health episode occurring because of a specific incident, so you get sent to a horrible accident as an officer and you're having a hard time dealing with that, that is a specific incident. CIVMIC, for the past year, has provided 6 sessions with a mental health professional for any officer that can say it's because of work and it's because of a specific incident. So we are already ahead of the game in terms of what the President wants Congress to do. One thing that I would like to see government look at the research tends to indicate that the mental health of an officer can be adversely impacted because of a specific incident, but not always. It frequently can be impacted because of a culmination of incidents. So an officer might have severe mental health issues and can't pinpoint to a car accident that they went to or a homicide that they went to. They instead they attribute it back to the job. So I think you'll see growth in that area to open up services to police officers and firefighters for the cumulative effects of the job. The final thing, or I think I'm nearing the end, and I apologize for the time, but it's very relevant right now. There is legislation that the governor of Wisconsin has proposed. These independent pieces of legislation will not be acted upon until January. The governor has already said that he will not call the legislatures back into session, and the Assembly and the Senate have already said that they will not call themselves back in. So a lot of these things we've talked about tonight, and a lot of these things we already do. So there's some things in here I have big heartache with. Elimination of the no-knock search warrant. So the police in some other state killed a woman while executing a no-knock search warrant. I don't know the specific facts of that case, but that's now being used to say you shouldn't be able to do a no-knock search warrant. Government frequently picks sides. You know, when we enact policy, we're picking a side. We're typically picking a majority side where it benefits more than it has a negative consequence against. If you enact a no-knock search warrant, if you knock that out, you are at that moment endangering police officers. Because if they're standing use a drug warrant as the example. If we stand at the house at a drug warrant and we knock on the door and we say, hey, drug dealer, come to the door, it's the police. They're not going to come to the door. They will dispose of the drugs, they will destroy the drugs, they will arm themselves with a weapon. There's just all kinds of bad things that can happen. No-knocks are not done on every search warrant. No-knocks for decades have required the officer to lay forth a series of facts to the court commissioner or the judge to get it approved to execute in a no-knock manner. Typically those facts evolve around the safety of doing it in that manner. Again, we don't do every warrant that way, but it would be a bad thing to not do some warrants that way. And I think that is it on legislation. Actually, I'll comment on the bottom bullet point. In the last legislative session, the Chiefs of Police Association in Wisconsin advocated for essentially a bad cop bill. If we have a police officer in West Allis that I tell you have to resign or I'm going to fire you, that police officer can go to another department and apply. And there are certain circumstances, I've never done it, I don't believe in it, but there are police chiefs and sheriffs that reach confidentiality agreements with people that they're looking to fire. If you go away and you leave, I will seal these employment records and I will not tell anyone that they exist. I think that's a bad practice. I'll never do it. I understand why some chiefs and sheriffs do it. It's easier to solve that problem than to spend $50,000 litigating with the person. So we had a bill that passed in the Assembly 99 to nothing that would make it so that all employment records of an officer at one agency would be known to the next agency that they're trying to go to, and it would give liability relief to the department that's providing the records. You couldn't get sued for providing the records. It passed in the Assembly 99 to nothing. It didn't get a voice vote in the Senate, and it died. And it had strong support from both sides of the aisle. Now, it's being talked about on a federal level, it's being talked about on the state level, and one of the things I'd like to say, the whole concept of police reform, some people would have you believe that we as a profession are trapped in the 60s or the 70s, that we don't try and make ourselves better, that we're not a constantly evolving profession. I can tell you the profession I entered 35 years ago, drastically different than the profession I work in today, in terms of how we train, how we manage risk, how we manage officers. So the police are always reforming. We're very open to reform, but as I've demonstrated tonight, a lot of the reform that they're calling for, we already do it, and we've been doing it for years. This is the final bullet point that I'll talk about tonight, qualified immunity. If you read newspapers, you have seen that there is a push in Congress to remove qualified immunity from police officers. So I've had a lot of conversations with Cale about this. Cale's a highly competent attorney. So the bottom line that I'd like to talk about on qualified immunity, it protects not only the police officer, it protects the city of West Allis. If qualified immunity is removed through federal legislation or state law, you will look at an increase in lawsuits against this city. It is plain and simple. It is nothing more complicated than that. Under the current system of justice, there are several examples in this country of very large payouts going to people that have had wrongful actions committed against them by the police. So even with qualified immunity, you can still prove a case that a police officer did the wrong thing, and the city would be required to pay that judgment. I've already covered that. I think there's one more thing. So this is what the courts have ruled. Qualified immunity is essentially a protection that allows an officer to act in good faith when they believe they are doing the right thing. That is what provides safety for them. Society benefits enough from the officers taking that risk that the benefits of qualified immunity far outweigh the negatives of having it continue as a program. This is definitely the final slide of the night. So if you look at my profession, most of the case law and most of the statutes say, Mr. Law Enforcement or Mrs. Law Enforcement Officer, here are the things you can't do. There are very few statutes that say, as an officer, you must do this. Some of the things I can think of, we must arrest people when it's a domestic violence allegation. We must render aid in certain circumstances. Other than that, a lot of the laws are designed to tell us what we can't do. That's how case law is written, and that's generally how law is written. So I will give you the example of a hostage situation. You now know that we essentially are not required to act. There is case law now that says law enforcement cannot be held responsible for not acting. You look at the case of an individual who wants to commit suicide, and they don't pose a threat to anyone else. In the past 5 years, you've seen law enforcement agencies leave the individual alone. Leave the house, let the person be if they won't come out and surrender to the police to be taken for mental health treatment. Prior to 5 years ago, you never would have seen that. Police would have stayed on that scene, and they would have eventually gotten into that house to try and take the person to a mental health hospital for their own well-being. However, court cases say we don't have to act. We have no liability if we don't act. So if we leave the suicidal person in the house, and they leave, and an hour later, a block away, they kill someone, we have no liability. I'm not going to say that we can't get sued for it, and I'm not going to say that new case law couldn't be created, because new case law is created every day, but under the current system in this country, the police would have no liability if we failed to take an action. So now with a hostage situation, if you remove qualified immunity, and an officer can have liability for acting, but they have no liability if they don't act, what will the officer do? What will the department do? So think of a hostage situation. We have a hostage taker. We have 2 or 3 hostages in the building. This has happened in our country. Well-meaning, well-intentioned police departments have entered to safeguard the hostages, and hostages have died, either because the police shot the hostages or the hostage taker shot the hostages. However, in an environment where we're going to be liable for acting and not liable for not acting, what would the officer do? What would you do? So that is the danger of qualified immunity. A U.S. Senator was recently quoted as saying, he's talking about the police and speculating it would be a good thing to remove qualified immunity. He said, if you're subject to being sued, you act differently than if you're not. And he is absolutely correct. You would act differently. You wouldn't act. If there is no punishment and no liability for not acting, and there is potential punishment and liability for acting, you won't act. So again, the judges have ruled that qualified immunity, the benefits of qualified immunity outweigh the negatives of it. So that is my presentation tonight. I just wanted to put some facts and some background behind a topic that you're probably, in your professional and personal life, you're probably all reading about and hearing about from constituents. I just wanted to come and have a chat. Thank you, and I'll take any question, but...
Mr. President.
Are there any questions? Alderman Vitale?
Yeah, Chief, I do appreciate really your explanation tonight. I think is very valid. Can you tell me how many police officers have been killed throughout the country? I must say 2019 as today. Do you have any figures?
I've read that, but I don't remember the data. Do you remember, Chris? It's a high, I know it's high.
Yes.
If I had to guess, I'd say it's around 80.
But I know it's high. I mean, it's very high. I mean, I don't have the precise number, but I know it's high. But the fact is, there's no mention or discussions. To me, I mean, when a sheriff or a police officer gets killed, it seems like the, I mean, I like to say it the way it is. The news media, they talk about just for a short time, and then it seems like it goes on the wayside, you know, goes someplace where nobody forget about it, you know. And to me, that's where some of the issues are unjustified. I mean, I could say there's certain elements within any police department within the country, you know, that maybe, like I said, they have maybe some mental issue. But the fact is, every time, I feel strong about that. A police officer, whether stops a driver or they're confronted in family disputes, I believe there's so much pressure out there, and the man that or a woman, whoever is causing the problem, doesn't care, don't think about sometimes the police officers are there. They do whatever they feel, and they cause them problems, you know. So I know what you said tonight, based on some of the rulings, you know. But the fact stands that many situations do arise in this country because many of the laws are not really effective. There is many things that lately been coming out with defund the police departments. And some of them really, they don't know exactly what the wording really means. Somebody says, oh, it's not just to eliminate the police department. Well, it is. I mean, it's not the, you know, you say, well, that's to make some adjustments. Well, then the verbiage should be changed. But when you talk about defunding a police department, it's insane. The way this country is today, with so many crazy people out there, and I tell you the way it is. I mean, I'm not going to beat around the bushes, you know, I'm not. Because that's what happened with society today. It's worse than 20 years ago. I believe the police, they have a hard job. And again, like I said before, maybe there's a few elements are bad. They don't need to have a badge. But in overall, 99% of the officer, they have a job, they have a duty, you know, and some of them, they try to respect the persons, you know. But the fact stands that those persons, they don't have no respect today for the police officer. in any communities, that's disregard the law. Because you know what? First of all, this country is crazy. You know, we all think about, we have to have guns, we have to have machine guns, we have to have this. Many people, that's how they react, because I'm getting protected, you know, because the government, you know, is going to take over someday, you know. To me, it's a big farce. So questions it is that I do appreciate really your concern that you addressed tonight, and like you say, some of those rules in Wisconsin or in Milwaukee or West Dallas here, we had those in effect already for quite a while, you know. So that's all I have really. I'm kind of disturbed about the whole situation, whatever occurred, you know, the chokehold, that's a bad thing, you know. But the fact in overall, let's not destroy building, not destroy small business people by marching. I believe you have the rights to march.
Alderman Vitale, I'm going to stop. We're not here to discuss
Well-
anything this evening. This was strictly an item on the agenda for the chief to present what is going on in the
But the
police
citizen
department.
has the
It's-
rights to know,
it's-
as an
yes.
alderman, how I feel
That's not
about
on the
what's
agenda.
been happening
That is not on
in
our
our
agenda.
communities.
That is not on our agenda for
Well,
discussion this evening.
it's in general. We talk about police.
Then put it
what's
on
been
the agenda
happening
for
in-
discussion
in
at
our
a-
state,
at
in
a
our
future
communities,
meeting.
throughout the country.
We're ge-
So there's no respect out there for the police department, what has been occurring.
Alderman
That's what
Vitale,
I'm
there's
saying.
many of us that agree with your viewpoint, but we're not here to discuss it this evening. Every one of us could come here and expound on our own experiences in real life and with the police and with our constituents, but this is not the time to do it. This was strictly a presentation by the police department to explain to us and to the community as to what their training is, what they're doing, and how they're addressing the situation today, and how they've done it in the past, and how it relates to what's going on in the world today. And I want to thank the chief for his presentation this evening. It was extremely enlightening. I hope it enlightened our citizens as much as it did the council. We're going to move on to the next.
Mr.
order.
President, I'm sorry, I had a couple
Oh,
quick
Michael?
questions if I
Sure.
could. Thank you. Chief, I'm just a little confused on the chokehold issue. Currently, they're banned and not taught, but under the presidential ruling, the president seems to believe that they should be allowed, so that means we're going to start teaching chokeholds?
No, no. So currently, they're not banned.
Okay, they're not banned,
But
but just
they're
not part of policy.
But they're not taught,
Yeah.
so it can't be used because it's not taught. Our use of force, it has to be taught for you to use it.
Okay.
So you don't see West Dallas officers using chokeholds because we don't train it. In the state of Wisconsin, it's not a part of our training program.
Okay.
Under the president's order, he doesn't want chokeholds either unless deadly force is authorized. So to comply with the president's order, we will specifically in policy say it's prohibited unless deadly force is authorized. So essentially, if you can use a firearm, you could use a chokehold.
Okay.
You were going to go 100 years and you're not going to see it used, is my guess.
And then my other question is on the pre-hiring psychological tests. Acting on the belief that none of us are the same people that we were when we were 25 years old, and talking to people in the community about this, the question has been brought up is, do we consider doing psychological retesting of members of the force after a period of time routinely? I mean, I understand the support system that we have for people that are dealing with stress, or whether you're going to call it PTSD or whatever, but is there any move to retest people, officers on a regular basis after a period of time, say 10, 15 years?
No, that's a good question. I am not aware of anyone that does that. However, as an employer, we reserve the right, and we have done it in the past, if we have very specific things that we can point to show that a member of the department is likely having mental health problems, we can order that member to go to a fitness for duty evaluation. The same gentleman who does our pre-employment evaluations would do a fitness for duty evaluation. So we have sent officers out It's mandatory for them to go. They get evaluated by a psychiatrist, and then he gives a report saying, nope, they're not good right now, or they are good. So we do have the right, with very specific information, to require essentially a mental health evaluation.
Okay, thank you. And I wanted to repeat what the other alderman said. This was a very good and very informative presentation. Thank you very much. And as you said, timely. Thank you.
Thank you.
Okay, thank you, Chief. Next item on the agenda is D1. This is a mid-year status update on the health insurance fund and employee benefits. All right, I'll turn that over to our city administrator, Rebecca Grill.
Can you guys hear me?
Yes.
Okay, great. My name is Alex Beaudry with the Horton Group. We are your health insurance consultants. During last year's renewal, we heard loud and clear that we don't want any surprises this year. So the goal today is just to, excuse me, this thing is really hard to talk in. The goal today is just to educate you. Yes, back up, Rebecca. There we go. The goal today is just to educate you on what's going on with the health plan, where we sit financially. We'll talk a little bit about COVID and how that's impacted the health system and what we expect the rest of the year to look like. And then as we get into the renewal cycle, we'll do a little projection on where we see that going. So this went out earlier this afternoon. I do apologize on the lateness, but we were scrambling to get this together. So this is our, is there a zoom in? Up here? Okay, well, hopefully you all, perfect. Okay, we'll go right here. So this is our reserve calculator. So this report lays out all of the city's health insurance costs, and then we put it into a loss ratio report that shows how much money the city is taking in the terms of your health insurance premiums, both what the city contributes and what your employees contribute versus what we are spending. So all the way to the left here, we have all of our fixed costs. So we have our medical admin fees, those go to Anthem to administer our plan. We have our stop loss fees, those also go to Anthem. That's how we have protection for large claims. Our RX admin fees, that's for our prescription drug program. We bake in our consulting fees here, and then we get the total fixed costs month over month. So this is what essentially the city pays on a month-to-month basis for your fixed costs, your premiums. That's about $1.5 million over a 12-month period. That number remains relatively stable. In the middle of this report shows our variable cost analysis. So this is our medical paid claims anytime someone goes to the doctor or the hospital. We have our prescription drug claims anytime someone goes to the pharmacy. We have our stop loss reimbursements here. So if anybody goes over our specific deductible, which is $175,000. So what that means is for every individual on your plan, whether it's your employee, their spouse, or their dependent children, everybody has a deductible of $175,000. So if I'm a city employee and I have $200,000 in medical bills in a current year, the city's responsible for the first $175,000, and we get reimbursed for any amount over that. So in that example, it'd be $25,000. So we pull that money out of our analysis because those are monies that come back to the city. So for example, in the previous plan year, March 2019 through February of 2020, we had $272,000 come back to us in the form of stop loss reimbursements. Lastly, in this section, we get prescription drug rebates. So anytime someone uses specific medications on our plan, those drug manufacturers reimburse the plan for using those drugs. It's called a prescription drug rebate. Last year, the city recouped almost $400,000 in prescription drug rebates. So we also pull those monies out. So then we add up the fixed costs plus the variable costs, and then we get a total cost analysis. So roughly last plan year, again, March of 19 through February of 20, we spent about $12.8 million in costs. Okay? Now, this does not include the Medicare costs, which are over here, or any of those other things. These are just your active and retiree folks that are still on the Anthem Health Plan. Then what we do is we look at the enrollment of your members, and then we times that by their premiums, the monthly plan funding. So this is how much money we're putting in month over month to fund our health plan. And at the end, we get a loss ratio every month. So like for the month of March 2019, our loss ratio was 114.59%. So for every dollar that was put into the health plan, we paid out $1.15. Okay, that's the easiest way to describe it. So we do that month over month. Our last 12 months for last plan year, our loss ratio was 98.8%. Okay, so we basically broke even over that 12-month period. So that's what that shows. We then show our Medicare costs. So these are for our retirees over the age of 65 that qualify for this plan. Those premiums are relatively stable. That's a fully insured plan that we use Humana to administer, and those costs remain relatively stable. So you add all of this up, our total cost, based on our numbers for March of 19 through February of 20, was just over $14 million. In this section right here, we show the change to reserve month over month. So in the month of March, our loss ratio was 115%. The city's health plan lost $160,000, or we spent $160,000 more than we paid in. As we go through the year, you can see that month over month. Obviously, black numbers are a good month, red numbers are a bad month. Through the course of that 12-month period, we are showing a surplus of $145,000 roughly. Now, when I get to the next page, we did change some of our reporting practices because we generally do this on a plan year basis. The city is unique in the fact that you have a March 1st renewal, okay? Most other municipalities have a January 1st renewal. We have a March 1st renewal. So when we were discussing things with Peggy, your former finance director, it was easier for her if we could get back on a calendar year basis. So our renewal date's not changing, but going forward, we're going to be doing our financial reporting on a calendar year basis. So the next report I'm going to show you overlaps a little bit with that. However, I did want to show our 19 and 20 analysis. The last thing I want to talk about is in this middle part of the report, we have our fixed cost per employee per year, our variable cost per employee per year, and essentially our total cost per employee per year. We like to call this number out because it's a good way to benchmark the city versus other employers. In this plan year, the total cost per employee per year for those that were on the health plan was $18,768. The national benchmark is right around $15,000, so we were slightly above that number. So it's important just to kind of look at where you are against the national benchmark, but it's also important because as you look to hire somebody, you can kind of get a sense for what their benefits would cost the city as they come onto the city's health plan, and that's about $19,000. Before I move on to what's going on in 2020, are there any questions about this report? I know it's a lot and I went through it relatively quickly.
Mr. President,
Michael.
you just spoke about the national benchmark. Do you have, it's my understanding that we in southeastern Wisconsin are blessed with higher than average healthcare costs.
We are, and municipalities are blessed with even higher, just because generally the average age of the workforce is higher.
Do you know what, like, say the Wisconsin benchmark would be, average cost per employee?
You know, I don't. The best I could do would be able to give you a benchmark of our clientele. We represent about 40 municipalities and school districts. That would be the best benchmark I could do. I would tell you that, you know, being mid-18, 18.7, that's not astronomical. You're not, you know, way above average. You're probably still slightly above average, but I have groups that are in the $24,000, $25,000 range where they're having some stronger financial problems. So while you're above average, I don't think it's way out of bounds.
Yep. Thank you.
Yep. Any other questions before I move on? Okay. So this is now calendar year 2020. So from the last report, this went through February of 20. So January and February are going to overlap a little bit, but this is in order to better help tie our reporting numbers to what your finance department is seeing. So far, through 2020, we're having a much better year. Last fall, we were having some significant financial issues, and the forecast for what the rest of 2019 was going to look like did not look positive. So we recommended making some plan design changes along with increasing the premiums that both the city and your employees paid. Those two factors, along with COVID and what's going on with our health system, have helped put us in a stronger financial position so far through 2020. So our loss ratio so far through the first 5 months of 2020, so we have data through May, is at 77.56%. So again, for every dollar that's been paid out, or paid in, excuse me, we've only paid out about 77 cents. So our running fund balance just for these 5 months, we're showing about $1.2 million in the positive. Now again, a couple of caveats around that. One, you'll see here that as the year has gone on into April and May, our loss ratio has dropped dramatically, excuse me. That is because we're always about 2 months behind. So when we're showing data in May, you know, that's really probably what was going on in March as COVID started to hit and the hospital systems began shutting down and people stopped going in for elective procedures and all the things that is going on with our health system. So as this continues, I would expect June and maybe even July to be more positive months for our fund balance. What's going to be interesting to watch is what does that rebound look like? You know, if I wasn't going in for my chemo or I wasn't going in for my diabetic management checkups, I wasn't getting my hip surgeries, how quickly do people resume and get back into the health system, and what does that do to our costs? It's a little too early to tell. I can tell you that the fully insured carriers are adding in factors to build in for that rebound. Now, is that just because they want to, you know, protect themselves from potential risk? Do they know something that we don't know? I don't know, but that's how they're playing this. So while this is a great number through the first 5 months that we're, you know, $1.2 million ahead of where we started the year, it's going to be interesting to see where that continues as things kind of get back to normal from a healthcare system standpoint. So far it looks like the plan design changes, the premium increases, those are working. What we don't know is what's the total impact of COVID-19 on all of this. Any other questions on this?
Mr. Chair, yeah, I have a question.
Alderman Haas.
Yeah, so you're telling us how things are. Do you have any recommendations for changes at this point, or just?
It's still too early to tell. I just, you know, this is generally good news. Last year at this time, it was more bad news, and the message I heard loud and clear was don't bring bad news late. So right now it's looking positive. I would tell you that if this continues, if this trend continues through the rest of the year, I would recommend holding pat. You know, let's leave premiums the same. Let's not jump to make plan design changes, unless, of course, you know, I'm told, hey, we need to find some money. Then we'll do that. But I'm hopeful that the health plan is stabilizing. Over the last several years, it's been in decline. Our fund balances continue to shrink. Our goal is to bring that back up to a healthy amount. So cautiously optimistic right now.
Thank you.
Are there any other questions from Mr. Beaudry?
Then really quickly, we just have some large claim reports. I won't go through these in great detail. I do want to just show that of the last stop loss year, so March 1st, 19 to February of 20, we had 18 members that reached at least 53% of or at least 50% of our specific deductible. That's quite a bit. We had, although we only had 3 people actually reach that amount, so quite a bit of reimbursement dollars coming back in. So far in this policy year, we already have 2 people that are right at that number. These large claims are something that we'll continue to monitor, because if we do have a significant number of large claims, that will also impact what our renewal is projecting for. So I did want to just show that. Last thing on this report before I turn it back over to Ms. Grill. We did implement a family savings plan last year. If you remember, that is the plan that we offered an incentive for your employees and their dependents and their spouses to move on to another employer's plan should they have access to through a spouse's employer. We rolled this out with some mixed reactions in March. We had some administrative hurdles we had to clear. However, the plan through the first quarter or so of us enrolling, we saved $54,000 in premiums. So that's the money that the city would have had paid for those family plans that we're no longer paying. We saved $20,000 in retiree premiums. We've avoided just about $20,000 in claims for those people in those populations too. So, so far the plan is showing some significant savings. We'll continue to track this throughout the year. Hopefully the employees that are taking advantage of this program are having a good experience because as people get closer to January 1st and their spouse's open enrollments come up, we would like them to look at taking advantage of the family savings plan where they can go to their spouse's employer but have all of their deductibles, copays, et cetera, paid for through that plan. So far I would call this mild success. We did have some administrative hurdles that we worked through. Hopefully it's leveling out, but the plan is showing financial savings. So that's all I had.
Any further questions for Mr. Beaudry? If not, we'll move on to Ms. Grill with, we'll be moving to item 2.
Can I try this again? Is it working now? No.
Maybe take your mask off and try it.
How's this?
No?
I'm just gonna hold it right now. Let's see here. Okay. Over the past few months, we've had a structural deficit committee where we've looked into different options and we're reviewing them right now on how we can reduce the structural deficit that the city is facing going over time because of expenditure restraint program, levy limits, reductions in our revenues and other things. So one of the ideas that was presented to the committee was to put forth an early retirement program. We brought this to the council a few months ago, just a general idea. We've been working with Horton to come up with something that would be beneficial to employees, but also to the city going forward. Alex just went over the cost of the city's health care, so it's very timely that you had that information as we go through this. So this is a program we're calling the Reduction in Workforce Plan, and it's actually for 2020 through 2021. There's a policy 1408. I do have, I have a link here. I want to put this out to employees tomorrow, but I just want to make sure that everyone has access to the links so they can get this information tomorrow. So that's why I included that here. Just a reminder about retirement ages for employees who participate in the Wisconsin Retirement Program. The normal retirement age for most employees is age 65, but at age 55, employees can retire early. The plan, I'm just going to go over a plain language from the policy, and then I can go through the policy if you want, but this information is basically coming from the policy. And the policy is based on the fact that we're trying to reduce payroll and health insurance. So it's not for positions that are going to continue being filled at the same rate, because that would not reduce the payroll nor the health insurance costs. It would just actually increase that, because we would have 2 people on our healthcare plan and things like that going forward. So in order to be eligible for this program, you have to be a non-represented employee, meaning you're not in the union. You can't be a sworn employee. You have to be eligible for retiree health care. There's different tenures that you have to have had for city employment to be eligible. We believe it was 10, then 15, and now new employees, they have to be here for 20 years before they're eligible for retiree health care. And then number 4, this is the one that I think is going to be the most confusing to people, but your position has to have one of the following things. It's been identified as one of the following. Either it's being eliminated, it's not going to be filled going forward, it's going to be consolidated with another position. Likely in some of those cases there might be a higher level position because of the additional responsibilities, or it's being reclassified. For example, it's a higher level position, and now because of changing needs and environments, we can maybe hire at a lower level, and saying that that reclassified position needs to be at least 30% less. And it's at the 3rd level of the salary. We usually are hiring at the 2nd or 3rd step of salary, so want to make it the same for that reclassified position. Number 5, in some cases, if a position's going to be consolidated or reclassified, that might involve more than one position, and people might not be leaving exactly at the same time. So for example, if someone leaves in September and then another person that we're going to combine a position leaves in December, we're saying that both of those employees would be eligible for that program because we're going from 2 to 1 position based on them both retiring. And the reason why there could be different dates is depending upon the position or the person holding the position, there's certain times where it might be more advantageous for them to retire. For example, after another work anniversary or around their birth date, we wouldn't want to say to somebody, we need you to leave on September 1st when their birthday is like October 15th. We would likely say, we'd like you to leave on October 15th if you're going to if you wish to participate in the program. So the employee has to be terminated after adoption of the policy and the date identified by the city, except in certain cases, some employees that retired after December 1st, but before the program, they might be eligible. Number 7 is the biggest thing. So the employee is going to agree to end participation in the city's self-funded health plan, except for COBRA participation. You just saw that for last year, our last plan year, it was over $18,000 per employee that we have cost. This year, we're around $15,000. So we're saying they need to end participation in the health plan. But for that, what do they get out of this? So the state of Wisconsin last year expanded their health insurance program whereby if someone retires and their municipality participates in the retirement program but doesn't participate in their health insurance program, at the time of retirement or when they become Medicare age, they can participate in the state's healthcare plan, which is similar to what the city has as far as premiums, or not premiums, but deductibles and coverages. I'll show you that in a little while. So we're recommending that we would give these individuals the lowest annual premium for Milwaukee. It should just say Milwaukee County, offered through the state of Wisconsin local annuitant health plan for 5 years. So if we're basing this on 2020 rates, that would be $24,317 $2,024.28, but we would round it up to 25,000. So essentially, we're recommending that for 5 years, these people would receive in a health retirement premium-only account $25,000. So for example, if an employee wishes to choose the Dean Health Plan in Waukesha County because their providers are covered in that plan, they would have an excess in their HRA at the end of 5 years, especially if they were an individual. The state plan doesn't have couple coverage like we do, so if you're a couple, you have to participate as a family plan. So this just goes through what the deposits would be and then the annual premiums for that healthcare plan. If they have some left over every year. So at the end of 5 years, if the person's 60 when they retire, at the end of 5 years, they'd be eligible to participate in the state's Medicare Advantage program, which has a monthly cost of $240 for an individual and $458 for a family or couple. Our plan, at 50%, employees are paying a little above the $240 and then $495 for a couple. So it's similar to what we're providing but as a city for those Medicare eligible. I'm not sure if you're able to see this, but the deductibles for the health plans, the individuals, $250, $500 for a family, and then the out-of-pocket limit is $1,250, $2,500. I believe ours is a little bit higher than that. Is it 500 and 750 and then 2,500? Sorry, ours is higher than, our health plan is higher than this. I will have to find out what that is as far as the out-of-pocket. But primary care office, we pay more than $15. Specialty provider, I believe we pay $40. Urgent care, I think that's $75. Emergency room, $350. So some of these are actually better than our coverage is. And then the breakdown of the pharmacy cost is on the other side. So essentially, a person who would choose to participate in this program, if we identified them as holding a position that met one of those criteria, we would basically pay their premiums for 5 years. They wouldn't have to contribute anything through the HRA, the deposit that's being given. And I just did some examples of what cost savings this could be. So earlier this year, we sent out multiple notices and information to employees about if there were an early retirement program, would they be interested? We had I think there's 11 people. Apparently some people never even heard of it until recently, so I'm sure there might be some more interest, but this is just based on the 11 people that responded. The average salary was, with the part-time people, it was 57. Without the 2 part-time people, it was 65. So that's why I have the 65 there. So if you look at a couple plan, the salary is 65,000. We're paying almost 16,000 for the health insurance, dental insurance, pension contribution. Then you have the HRA contribution, and then, so in 1 year, you would be saving 61,000 and then over 300,000 for a 5-year savings. And then it illustrates the individual and family. So there's a possible savings of $700 to $1 million, dependent upon the participation and whether positions are eliminated, combined, or reclassified. The goal would be 10 in 2020 and 10 in 2021, and then we would realize the full cost savings in 2022. Are there any questions?
Questions?
I have a question.
Person Keen?
So this, employees could opt into this, correct?
We would identify people that would be eligible, because we're not just going to have everybody that is retirement age say that I'm going to be part of this, because we're not eliminating all those positions.
Right.
Yes.
Okay, and then in one of the attachments on the policies and procedures under department heads, identify the positions for elimination, identify a time frame for employees. So could you clarify that? Is that department heads looking for people who are eligible and approaching them to give the offer, or recognizing employees that are eligible and then potentially terminating them?
It's more about identifying the position first. So there's certain positions where we've already made decisions not to refill them or to combine them with somebody else. So we would look at the incumbents of those positions. We'd probably also look at people that have shown interest in participating and see if there's something we could do. But it's more about looking at the positions than the person. But once we identify the positions, then we would look at the person and say, when would it make sense for us to ask this person if they wanted to participate, when they should leave, like I mentioned with the birthdays or the calendar anniversary. So.
Okay, thank you.
Any other questions at this time? I know we'll be discussing this later in Finance Committee.
Yes.
If not, you want to move on to the next item?
Sure. All right. The next item is a discussion regarding possible splitting of the finance director, comptroller, and treasurer position. Peggy Stino, who was the finance director, she also held the positions of comptroller and treasurer. There was some desire to talk about maybe splitting off the treasurer position from the finance director and comptroller position. There, I guess, for two reasons. One, segregation of duties, splitting off, separation of powers, I guess. The person who takes in the money then checks to make sure that the money was taken in correctly. Sometimes it's good to have that separated. Additionally, just the amount of work that the treasurer or the finance office department does, just their responsibilities are pretty extensive because of all of our different opportunities that we're dealing with, our initiatives such as early retirement programs, total benefit package. There's just a lot of things that the finance department is involved in. So this is just before we put the recruitment out for the new finance department director, I wanted to have the discussion that was desired. I know that I've talked with Chris Moan, who is the interim finance director. She has some concerns regarding staffing because there's overlap in the treasurer's office staff, and they help the finance doing accounting services and things like that. So she's concerned about not having enough assistance with completing those, the tasks of the finance department. I think that could be overcome by we're trying to work towards more departments collaborating versus us working in our silos. So I think that could be overcome that way, and just some restructuring. I did look at some other municipalities. No, I'm not going to find it. To see what they did are mainly our statewide comps that are comps by population, and also Milwaukee County. I didn't get to look at the wider Midwest, but so in Oak Creek, Madison, and Milwaukee, they have a separate finance and treasurer or comptroller and treasurer positions. In Janesville, Waukesha, Racine, and Kenosha, they split them by having the treasurer with the clerk. And those are, so Racine and Kenosha are closer in population to us. I would not suggest that it would be good to put that with the clerk's position. If there was a consideration, I think it, in my opinion, it should be a separate department. But that's just some background on the discussion item.
Thank you. Any questions? Not, we move on to the next item. Do you want to go into closed session for these next two items?
Yes.
Okay, for the items 4 and 5, the committee will convene in closed session pursuant to provisions of Wisconsin statute section 19.85, parent 1, parent E, for the purpose of deliberating or negotiating the purchase of public properties or the investing of public funds. The committee will reconvene in open session after completion of the closed session to consider the balance of the agenda. Is there a motion to go into closed session?
So moved.
Second.
It's been moved by Alderman Ranky, seconded by Alderman Haas. Alderman Haas?
Aye.